Thank you, George. Well, tracking Ebola this morning. As of today, both nurses infected with Ebola are no longer in Dallas, and the president is responding to the growing number of Ebola cases. Tracy Potts has more.
Before Nina Pham arrived at NIH last night, we got our first look at the Ebola-infected nurse in good spirits in her hospital room in Dallas.
Party, Maryland.
We're also getting a first look today at what the CDC's doing to stop this virus. The government released these pictures last night. They're now doing temperature checks at 5 airports. Lawmakers, mostly Republicans, are pressuring President Obama to ban travel from West Africa.
The president ought to at least stop non-U.S. citizens from those 3 affected Western African countries from coming here.
But the president says a ban might prompt travelers to hide where they're coming from, increasing our risk.
We could end up having more cases rather than less.
There's no such thing as Fortress America when it comes to infectious diseases.
He is considering a so-called Ebola czar, one government official to oversee the response. That could now include reserves and the National Guard. President Obama's authorized them to head to West Africa if needed. The World Health Organization says West Africa could see more than 4,500 deaths from Ebola by the end of this week. Tracy Potts, NBC News, Washington.
Happening now, a Minnesota woman is sending food to some people who need it the most, those who are quarantined for Ebola. She's gathering non-perishable items for her food drive to send to families in her native Liberia to help feed them while they're in isolation. She says she's getting a pretty positive response to the project and hopes others will be inspired.
Know the facts and don't have fear. We could be more responsive and more supportive.
Once all the food is collected, Global Health Ministries will pack it up and ship it overseas. With Ebola screenings now ongoing at major U.S. airports, many are scared to travel. But medical experts say it isn't that easy to contract Ebola while on a plane with an Ebola sufferer. The virus is transmitted through direct contact of bodily fluids. So it is possible that if you touched a seat or tray table that a victim coughed or sneezed on, you could contract Ebola. But airplanes are cleaned thoroughly after each flight, so it is unlikely.